Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, 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 ATH Alice. Welcome to our weekly show. My name is Abby. I'm your Healthy Living NP. How are you guys doing? We are going to be, so you can see today's topic is tips for managing seasonal allergies. So let me get into my banners here. Thanks for joining again. Please invite others. Please share the show. Please give me a like right away too, so because it's going to be a great show. Of course, I always bring very informative shows. Please click the button there, click the like button, and welcome if you join me from YouTube and also from Focus on Liberia and from the page. If you're new here, thanks for coming and joining us. Okay, so let me just get to our topic here. So we're talking about seasonal allergies. So if you live in place in my time of my part of the country, or in places where the weather has like drastic changes, where you go from winter and summer and snow and all of that, the seasons are going to change, and especially around this time of the year. I think some other places is like winter now, like in Australia area, they go into the winter months and all. So I don't know too much about that, but so the weather changes, and what the weather changes is nice spring and nice weather, and it feels good. The ducks and everybody coming out and playing, and people are having fun. And that's when the season change, and that's when you start getting the sneezing and coughing and the pollens and everything in the air. So for some people, it can be that much of a bother. It's like, okay, I can do that and get it over with, and my life is okay. I don't have to stay inside all the time. But so for other people, like they literally will have to stay inside all day and can come out till later on in the afternoon or later on in the evening. So if that's you, this show is for you. If you're your family member, this show is for you. So let's get right into it, okay? So, seasonal allergy, what exactly is seasonal allergy? Right. Okay. So, again, my disclaimer, sorry, I am a provider, but I'm not your provider. So, please do not make any changes to your regimen without checking with your own provider first. Okay. So let's get right into it. So your immune system, okay, you have all these like your digestive system, your all the skeletal system, and all that. Your immune system is the part of your body that does the fighting of infections and all. Okay, so the histamines that come from all the pollens and all the different things you see flying in the air, sometimes you can't see at all. All right, but then you can see the pollen stuff all over the cars and everything. So they come into the air, and usually, it comes into somebody who doesn't have seasonal allergies, they sneeze, and that's fine. But for some other people, the immune system see that as like something attacking the body. Okay, so it goes into overdrive and it overreacts. They start sneezing and the watery eyes and everything else, and it gets and becomes so uncontrollable that sometimes you need medication, or again, you have to go inside and stay inside and do other things to help you get through the day or to get through the season. So it's basically your body just overreacting to something that will be kind of normal, but it just overreacts to it in the way that doesn't really have to, but people get seasonal allergies from that. So according to the American College of Asthma, Allergy, and Immunology, all right, it's 50 million Americans suffer from seasonal allergies. Now, people in America and all that too. This is not like the World Health Organization stuff. I'm sure it's more than that, depending on what part of the world you live in. Okay. So we'll go into there and I say, okay, well, so what are people who get seasonal allergies? What are their risk factors? Now, some of these risk factors I'm going to name, it's not all inclusive. And some people, I didn't have any of these risk factors. I didn't start getting seasonal allergies till later on in life, because I used to be one of those people where I never got sick in the wintertime. And then in the springtime, it would be like I'll be sneezing and all. And after a while, I said, wait a second, maybe I do have seasonal allergies. And I used to love sitting on the grass, like just laying in the grass, and because this time of the year, I love it. But I can't also, when I discovered also that I am allergic to the grass too, because I start itching, my body starts itching. And then, it's like I'm like scratching so badly. So some of the risk factors here could be, let me go to here. So what are your risk factors for seasonal allergies? Okay. Okay, so Genetics. So basically, like a first degree relatives, like your parents or your siblings and all that, they have seasonal allergies. Chances are more than likely you do, you have a higher chance of developing it. Again, like I say, your sibling first relative. Environmental. If you live in places where have like a lot of trees and other things like that, closer to like the river area, most of the time, like in the suburban areas, okay, or places again, like I said, a lot of trees and all of that, and the seasons change, of course when the leaves come back on the trees, it comes back in full force, and you're prone to that. Not like you can get it in the city, but it's like in the city part, you don't have too many trees and all that there, so you're not really prone to it. But in the city, people have like they're closer to the dust and everything else that comes along with being in the city, so you can also get seasonal allergies. But most of the time, it's environmental. Some people who have lung diseases do things like asthma because you already had that airway impairment already. So when your body overreacting to anything that it finds that it's going to be attacking, that it's going to even overreact even more. And also smokers too, because your lungs are already impaired. You're smoking, you're closing your arteries and all that, your blood vessels, and also like, your body's going to react even more to it. Okay, so you sit there, you'd be like, okay, so I don't have. For me, I didn't have any family member that had those factors and all that. I think my brother had asthma. I'm not sure, be like childhood asthma, but and I also live where like especially where I live right now, just like trees everywhere. Okay, and I live close to the stream and all that too. So like, even before that, when I lived different places, depending on where the city or the part of the country you live in. Also, so it's not just basically like in your neighborhood. It could be like the part of the country you live into. Okay, so that also increases your risk for that. So and again, like I said, sometimes it's none of that. I'm not making this show long, by the way. Okay. So, what are some of the symptoms I'm talking about? Itchy eyes. Oh my God. It's like your eyes get so dry and itchy and you're scratching and all, especially when you see the little kids, the one that have it, and it's so sad. Already. My glasses are reflecting. Sore throat. Sometimes like if you find yourself like you coughing more and you swallowing more because you feel it's like itchy and scratchy throat, red in eyes, itchy, watery, red in eyes, watery eyes too, where it's like it's just clear drainage. Okay, it's like just teary eye. If it's anything more, if it's not tear, if it's not white, clean tear eyes coming out, if it's like discolored or like tan and all, then you have the different kind of conjunctivitis where we would say like leading to pink eye. But most of this one is like just teardrops coming out. It's not teardrops, so it's like it's the clear tear eye. So it's got allergic conjunctivitis. All right. Coughing because your throat's so dry, so you try to moisten your throat. Nasal congestion, where it's like everywhere, but your sinuses are so blocked because and you can't breathe, and you start having headaches and all that. Sometimes fatigue because all of this your body has to go through. All right, the blocked sinuses, headache, and fatigue. Like I said, again, this is not all inclusive too, so I'm sure there's more to that. So when you're going through this and you're like, oh my God, I feel like this is too much. And people like think about it. If you somebody who like really prone to it, you have to go through this like all spring from for us it's probably like maybe what spring starts in March. What depends on what part of the country you're in, and then now like spring takes forever to start because winter just goes right into it. In that way, you have an advantage because winter takes forever to go, so it doesn't really start getting like that until late April. Okay, so like and then when you get to June or June-ish or something like that, it start getting really hot. So but so you imagine so having to go through that. So mainly you have to spend most of your time inside anyways. You go to work, you go inside, you stay inside, you can't even come outside, enjoy the nice weather, or you want to go play in the park. Your kids want to go play in the park, you can't even do that because you're going to be coughing so much when you come in, right? So you say, okay, well then how can we deal with that? Because I don't want to be, I want everybody to like go out and enjoy themselves and all that. Again, like I said, we're going to be living our lives intentionally, right? So enjoying every season. I mean, I say that, but like winter, I'm hibernating in the winter. So let's get into that. So let's get into our treatment here. So okay, so treatment. There are so many treatments. Okay, so most of it will be like over the counter. Like you talk when you go to your doctors for and you say I'm going through this and I need some help. And most of the time you can just watch TV and see all the different treatment plans on there too. But again, you're going to be talking to your doctor first because you have to know which is safe for you or not. Okay, so over the counter you can get the over the counter. They have your I'm talking about your Claritin, your Zyrtec, all those other ones. You can take that again. That can also interact with other medications you take. So make sure you ask your doctor first, okay? And cough medicine for the cough, sore throat. My friend gave me ginger snaps and all this nice little candy. I like ginger, but sometimes it can be strong for the throat, but it's good for if you're having like a sore throat. Alrighty, and back in the day where we used to be moist down with the Vicks and all everywhere in your nose and every like, oh my God. But anyways, inhaler for your sinuses, because you have to make sure you open up your sinuses, because if that's blocked, you can't sleep and you can't really do anything when your sinuses is so blocked and you're talking. You can hear the person talking also nasally, and it's like right above there. Alrighty, eye drops also. You can do the eye drops for the allergic conjunctivitis. So the best thing to do is do that first thing in the morning, and then also if you have to do it at night again, or if you have to do it during the day. So depending on how it's ordered, or depending on what the manufacturer instruction is, if you get it over the counter. Okay. And again, like I said, the forms, the tablet form, you can get that over the counter as well. Alrighty. There's also this this nasal thing we used to, people used to put that in their nose and like breathe on there. You go there and you breathe in there. And I see a lot of people used to like hold on to that and just be doing that all the time. Now that's not safe, because again, like I think I mentioned this before, when you putting that in your nose, it's supposed to block your airway, so all these histamines don't come into your body and go into your body system there. But that also closes some, it closes the blood vessels in there, but it also closes some of the larger blood vessels. And if you also suffer from hypertension, which is high blood pressure and all, that can also increase your blood pressure. Okay, because it's not open wide for all the air, the oxygen and everything to go through, so that can also put you at a high risk for having a heart attack. So you have to follow the manufacturer instructions on that, saying this is how often you're supposed to use it. And if you find yourself using it more often than not, then you need to tell your doctor, say, my allergies are not under control, can you give me some other ideas to use? Okay, so let's say you have to use the eye drops. Okay, I do eye drops because I have dry eyes already. I did a video before on how to do your eye drops. So if you're doing your eye drops, you want to make sure you reach for your eye here, pull the eyelid down, and you can just go right in there. I always tell the patients, look up at the light. Look up at the light. Okay, you can do it right there. For little kids, you can lay them to the side and just put it right in the corner of the eye here. Put it right in the corner there, and just tell them, like, go ahead and squint your eyes a little bit. So when you squint, and even if you're the grown up too, all right, and elderly people, they don't like doing the eye drops either. So you do that squint, so that way like disperse all into your eyes. So make sure you reach for the lower lid, all right, and then just go ahead right in there, because if you're trying to do your eyes and keep it open to put the eye drops in, that's going to be really uncomfortable, and it's also, you don't want to scratch your cornea or anything like that. So pull it down and just go right in there and just drop it in there, and then just squeeze your eyes for it to disperse. Okay. Also, if you have to do your nasal spray, this is just a regular nasal spray, not the one that I was talking about that you sniffing. So you do that. Make sure it's pointing upwards when you put it inside your nose. Make sure it's pointing upwards. Don't do it like that, because you do that, it's just going to go down the bottom of your throat, and then you're going to be like, oh, you don't, and then it's not doing you any good, because it's supposed to go in there and go up to your sinuses. So make sure you go in like it's pointed this way, straight up. You breathe in, you put it in, you breathe in, you hold it in a little bit, squeeze in, and you do the next one straight. Make sure it's pointing straight up. All right, straight up into your nostrils there. Okay, and then you breathe it in, so you can feel it in here, not in the back of your throat. Okay, so because most people will do that, and then it just goes right into the back of their throat, and it's not doing you any good. Alrighty, it's just going to give you like a really nasty feeling in your reflex area there. Okay, so I did that. That's your eye drops and your stuff. So make sure when you're doing that first, and you do that, you do the eye drops, always have your tissues and everything close by, because you could be sitting there and be like, oh my God, I'm reaching for something. I'm reaching for something, So have your tissue close by, wipe your eyes, good. Wash your hands when you're done, especially if you're doing it to for somebody else, a child or family member. And you might say, that's my family member, I don't have to wash my eyes. No, but at the same time, you don't want to give yourself any kind of infection. And please do not share that with anybody else. Do not share with anybody else, whether it's your spouse, your child, or nothing like that, because that person could have an infection going in their eyes that you do that. So please make sure you're not sharing that with anybody else. Okay, everybody should have their own little thing there. All right, and I understand sometimes it can be a little, some people who can afford to buy, one for everybody else in the house. But it's just that when the person gets sick, you have to spend more money with copay at the doctor's office and all that. So if it's possible, do not share with anybody. Okay. Alrighty, so I went over the treatment there. So what's some of what you can do that prevention? When to call the doctor? Okay, let me put my glasses back on now, because alrighty. So when to call the doctor? So of course, allergies don't is not supposed to land you in the hospital. It's not supposed to land you in the doctor's office. It's something that really that you self-limiting, meaning that you can manage it at home. But when do you have, you'd be like, wait a second, I know my body and I know it doesn't feel like I'm well. Okay, so if you start having a fever, alrighty, you feel yourself getting feverish and warm and all that, and you say, okay, there's something going on, right? Also, when you go to the doctor's office too, we might say, well, when do you get these symptoms? Oh, I get it every time around the springtime, around this time of the year. Then that's seasonal allergies. If you're getting that different time of the year, or you never got this before, or it's so much worse this time around, and all, then we'll say, okay, maybe there's something else is going on there. Okay. So you start having like fever, you do your temperature is like greater than 100, and you're like, okay, and I do feel feverish. I feel a little sluggish. I don't feel like myself. The sore throat is becoming like much more painful. If you're having any difficulty breathing, all right, please call 911. Don't sit there and say, I'm going to wait and see if that's going to, because you don't want any problems there. You don't want anything that's going to close your throat. Again, we're also over the counter medications too. You want to watch them, read the manufacturer's instructions as well too. Okay. Severe body aches, again, like I said, you feeling feverish, increased fatigue, difficulty swallowing, and coughing. And when you coughing now, and you start bringing things up when you cough, it is any blood, if it's like discolored, because we usually say, like, what is the color of your cough? If it's clear, like, what is he telling me? It's like thick yellowish, and I think it's green. Or I try not to gross you guys out, but these are some of the questions going to be asking. And then also, COVID is always around too. Alrighty, bronchitis and all that. So we want to say, okay, now it's not seasonal allergies, it's something a little bit more. We're going to get that checked. Okay. And call your doctor and say, no, I know I have seasonal allergies. All right. But I think this is something more that's going on. Maybe I just traveled somewhere. Maybe I was out at a party somewhere, and I must have caught something, or maybe somebody else in the house, I must have caught something, or maybe just have an infection going on, maybe from my work. For those of us who work in healthcare, we're exposed to everything else. And but it's just when you're in the general population too. Okay. So you can say, all right, it sounds good. So what are some of the ways to prevent it? Of course. So seasonal allergies prevention. You want to watch the weather report. Most people don't watch the news anyways, but it's right on your phone. You can literally look at the weather app, and it will tell you the pollen count and everything, how high it's going to be that day. And it will tell you, when it's safe to be outside, what time it's safe to be outside, and all that. They really go into detail now when you go into, when you just, because usually I just look at it to see what the weather is going to be for all the rest of the day, but I don't like kind of scroll up to see everything else that's going on there. Alrighty. If you're gardening this time of the year, people are planting their flowers and their produce and everything, wear N95 mask. Okay, so you're not breathing. And you see those people who are like professional landscapers and all, they always wear like long sleeve stuff. And also when you're not touching anything else, because when the histamine hits your body, sometimes it itches. That's with me. When I go for my walk and I go into the park, I come home, I got to take everything off and take a shower and all. Okay. So make sure you're covering your breathing, if you can help it. If you don't have the N95 mask, because sometimes it's expensive. Not expensive right now, but if you can get the regular, even the surgical mask, the regular one that we used to wear, put that on. Okay. Try to drink a lot of water to make sure you keep your mouth, your throat, everything nice and moist all the time. All right. So it doesn't get too dry, especially if you're using inhalers and things like that. And if you have asthma, you do your inhalers. You're supposed to be drinking and gargling, all that to protect your throat. Alrighty. If you, again, you go out there running or just walking in the park or gardening and all, take your clothes off right away, put it right in the bag. If you can do laundry right away, put it in the bag. And then when it's time to do laundry, you do laundry. If you take your shower right away, don't go sit in a chair or go sit on the couch and be talking. I know sometimes it's difficult because you're not ready to take a shower if it's like right in the middle of the day, or early in the afternoon, or early in the evening. You want to eat your dinner, you want to hang out with your family and all. But as soon as you can, go ahead and take that out. All right. Keep the windows closed. Sometimes you want to get fresh air, and during this time of the year, every once in a while, open it just to get some of that dead air out. But keep it closed because the histamine is going to come in and all that. So the pollens and all is going to come in. Alrighty. If you can get an air purifier, go ahead and get that. Keep the windows closed. If you have pets, make sure they're clean before you come in. My dog, we used to wipe him down with the fabric softener and all, but they have different things that you can wipe your pets down. Pets also do have allergies too. So you find them sneezing and they go in outside and you see them, you can tell when your pet is in distress. Check with your veterinarian to see if they need to get on medications too as well. Okay. And if you can wash your hair, come in, brush your hair over like a moist towel or something like that, just to make sure that it's not in your hair. Because if it's in your hair and you lay back in the couch, or you go back to bed or you have a bonnet on and it's still in the bonnet, that's going to make you cough even more. Okay. So basically, that's pretty much it. How you do that, but again, it's important that make sure you check when to know when to go to the doctors and all, because I don't want you sitting home thinking, oh, maybe it's just my allergies, and you're going through crazy, all that. So I don't see any questions there. Let me just see. Give me a chance there. This person says, hoping to join this program to talk about Liberian youth and drug abuse. What's your name? Sugar Deacon. Oh, inbox me. Maybe someday we can talk about it. I don't know too much about it over there, but over here. But I wouldn't mind coming on. I always love to have people come on already. And okay, same person already. So, but they're talking about something else. So I will read that later, and you can inbox me if it doesn't have to do with the topic that we're talking about. Just inbox me, okay? Alrighty. So let me go back to my banners here. So basically, that's what it is, making sure you take your medicine. And the important thing is, if you take the pills for allergies too, especially during that time, take it early in the morning. Because I usually take mine early in the morning before you go out there, so you're protecting your body right away. You're blocking that. You're taking the antihistamine, so you're blocking the histamines from coming in. Okay, so basically, it's like, okay, I'm arming myself before I go outside. Do your eye drops and everything before you go. Your nasal, if you don't, and have it with you just in case, if you're feeling that you need to repeat it in the daytime. Of course, excuse me, of course, always follow the manufacturer's instruction. Also follow up with your family doctor too. And for those of you who have lung diseases and you see the pulmonologist, also ask for them to say, is this safe for me to take this and all? Because sometimes you're taking other medications that you're taking that it can also interact, especially like I said, that nasal thing that people use to breathe on all the time. That can also increase your blood pressure. So you don't want that. You want to manage your seasonal allergies. You don't want to sit there and cause yourself a heart attack because of that. Okay. So I think I answered all the questions. Sorry. And I don't like going too long anymore. So let me just see what here. Of course, if you have any other questions, let me see here. Jackie Jackson said, great topic. Hi, Jackie Jackson. I hope you're feeling better today. But so yeah, basically, so take care of yourself and each other. And of course, like I said, I'm here Tuesday. If you're new here, I'm here Tuesday at 7 p.m. every Tuesday. And I do Abby's Daily Dose, these shorter videos during the week. And sometimes I do another show during the week, but most of the time it's Tuesday at 7 p.m. I'm broadcasting focused in Liberia and also to YouTube. Alrighty. And then anybody want to do a show with me, as long as it has to do something with healthcare and all that, we can talk about it. I like to talk about things that I know about. I'm willing to learn and all that. But if you need an avenue to talk more about certain things that relate to our community and the community at large, of course, I'm here. Alrighty. So thank you all for watching. Thank you all who will be watching later. Again, Facebook's deleting different videos and all that. So if you don't see it here, everything's on YouTube also. I broadcast the same time on YouTube, but it stays on YouTube. So you can go back and watch it at your leisure. If you have any more questions, please leave it in the comments section and I'll be more than happy to read it later on and respond to it. Okay. And of course, you can also inbox me too. Alrighty. So thank you all for watching. Take care, stay safe, and stay happy. Bye-bye now.